Thank you for bearing with us as I learn a little bit of new technology here, so this is great. But again, it's our way that makes sure that a lot of people have access to this information. So just want to go over some partners who have joined with us for this really important endeavor. Want to acknowledge 3 different Ohio departments. So we have the Department of Health, Department of Mental Health, and the Department of Alcohol and Drug Addiction Services, as well as the Best Center for Schizophrenia here in Summit County, the Ohio Coordinating Center of Integrated Care, and us, the Center for Evidence-Based Practices at CASE. Today we're going to be talking about tobacco and behavioral health. So the critical pieces that we want to make sure people walk out of the room with is just understanding the extent of the issue with this population, some of the very special pieces when we're thinking about treatment interventions, both pharmacologically as well as psychosocially, that's critical in this population, as well as talking about some services and some activities that are happening throughout the state so that people are aware of what's going on. We ask that you hold all your questions till the end, and we will go around and have people ask the questions that they may have. So we'll get to that towards the end. Just a brief disclosure to make sure everyone knows that the center has not received any funding from tobacco companies or pharmaceutical companies for our work here. Some of the information that we will be presenting, though, is off-label uses of some of the available products, and so we will point that out when we get to that. But just so that you know that it's from literature-based, but it's off-label from packaging.
Hi, Cleveland's checking in. We just got here.
Welcome. Thank you. At this point, I want to turn the podium over to Dr. Marion Sherman, who is the medical director for the Ohio Department of Mental Health, who's graciously agreed to say a few words about tobacco and where the state is with our project. Dr. Sherman?
Thank you so much, Deb, and thank you to the center for doing such an excellent job in terms of working out this best practice and educating folks around the state, being a true leader in this and the other best practices that you've combined this with. I'm truly honored to have been a part of this with you. I hope that we can continue to work together. The challenges with funding have been heartbreaking, but we will continue to fight for the folks that we serve, for those who struggle and live with mental illness and severe mental illness. And this is a population that has been so cruelly stricken with this very addictive substance of tobacco. I mean, as you will learn and enjoy the educational seminar today, understanding that we do have effective treatments, we have effective interventions with this addictive substance, and for the folks who we serve in our system, they struggle 2 or 3 times the risk of having tobacco dependence as a general population. Tobacco is devastating. It impacts all areas of the other physical health in addition to the brain problems that it causes. And I am so proud of Ohio to be a leader and to be joining the national push to try to help the folks who we serve who struggle and live with mental illness to be able to better fight this dependence. So I really don't want to take any further time away from the important items that are coming up. Again, I thank you very much for your leadership. I thank you to Dr. Offit Killinch, who is our representative leader here at Ohio Department of Mental Health, and for all of you who have come out from across the state and have taken some time out from the very, very important work that you do, serving the folks who are struggling with one type of brain illness or another, to learn enhanced interventions and treatments and the warnings with these treatments for folks who struggle with tobacco use and dependence. Thank you.
Thank you very much, Dr. Sherman. Next we have Lon Herman, who's the director of the Best Center. Can we advance the slide one? Just push.
Okay, well, good afternoon, everybody. And for starters, I want to thank you for taking time out of your busy, busy schedules to invest it in this very, very important training session. The BEST Center, which stands for Best Practices in Schizophrenia Treatment, is located at Northeast Ohio University, Colleges of Medicine and Pharmacy. We're hoping to change our name in the near future. Not the Best Center, but the college, so that'll be easier to remember and understand. Among the 4 areas that the Best Center is focusing on initially is integrating physical and mental health care. As many of you know, the risk of years of lost life is substantial for people that are affected by serious mental illness, and even more on point, a very, very large proportion of that is associated with the illnesses caused by smoking and tobacco dependence. So we have, if you will, sort of an epidemic and an epidemic within an epidemic that you'll be learning more about treating today. Secondly, and I think this is also critically important not only to you but with people that you work with, is that treating tobacco dependence with these individuals requires some specialization and requires going about it in some ways that are different than that for other populations. And I think understanding those distinctions and understanding those differences and being able to act as a result of those is really what's going to make the difference here in terms of limiting those years of lost life. We are very happy to be able to host this session here at Neo-UCOM. As you'll see, the Best Center's website is up for you to take a look at. You can learn a little bit more about some of the other initiatives we're involved in Northeast Ohio to help people with schizophrenia and their families receive evidence-based practices and to really help people and their families recover as quickly as possible. So with that, I will turn this over to Jonas Tom, who's the Director for the Center for Integrating Care. Thank you.
Thank you, Lon, and thank you, Deb, and thank you to all of the attendees and participants here. I really appreciate it. Like Lon said, we know how busy everybody is, and we appreciate you taking time for this very important topic. We need your help, as Lon indicated, and as Deb will indicate, and Dr. Delos Reyes will as well. Folks with severe mental illnesses are dying decades earlier than the general public, and they have higher rates of comorbidity, cardiovascular disease, other heart diseases, diabetes, obesity. There's a number of comorbid risk factors that are overrepresented, some of these illnesses, in folks with severe and persistent mental illness. The good news is that many of the risk factors associated with these illnesses, such as obesity, diet, nutrition, substance use, including tobacco, are all preventable and modifiable. And we know that partially from the great work of Case Western Reserve University and the Center for Evidence-Based Practices, that complete reversal of risk factors is not necessary. So we really appreciate all of your work and attention today, and all of your work in addressing substance use and tobacco use and dependence among folks with severe mental illnesses. As Ohio providers, behavioral health providers, develop integrated care services, they're developing really 3 kinds of services: clinical direct services, coordination and collaborative care services, and prevention and wellness services. The work in tobacco dependence and the work that you're going to learn about today in possible interventions really touch on all 3 of these areas: direct clinical intervention, how to consult and collaborate to provide better care, and how to promote prevention and wellness kinds of services through education and empowerment. So again, thank you for your attendance and participation today. To learn more about the Ohio Coordinating Center for Integrating Care, please visit our website, occic.org. Thank you.
Thank you both very much. And those websites are in the slides in your handouts as well, so you can have that information and look up as you need to. So just pure slides now. Thank you for your patience as I learn this technology. Actually, I'm not learning it. I'm letting Ray just take over.